Hello everyone, I'm Suparuj, dermatologist from Bangkok, Thailand. It's really my honor to share with you my experience using the rose stem cell dry exosome in many of skin conditions. So I would like, because I have a lot of to share with you, but a limitation of time, so I will focus on the clinical application. Okay, so as all the professor mentioned, the most important content that work in the exosome is about the microRNA that have the effect of anti-inflammatory, promote proliferation, migration, angiogenesis, and the most important is anti-scarring. So I would like to focus on some of most important. You have to be sure that what you are using is the pure exosome, because if you got the conditional media that are not pure, you can get some of the inflammation and got some of the skin reaction. And I'll do the in vivo study to see the efficacy of the exosome, is that it really work. So I do the fractional CO2 laser on the skin surface, and you can see that applying exosome, you can see the significant reduction in the inflammation since the 3 hours. So applying exosome, shortening the time for sure. And I know that in Vietnam, the fractional picosecond laser are very popular also, right? For the treatment of acne scar, because we have the high risk of post-puberty hyperpigmentation. So I perform the treatment with the fractional picosecond laser high fluence and apply exosome one time, 2 times, 3 times for every 2 hours. And we found that the exosome show the benefit better than the control moisturizer. Okay, and what we found is that the more we apply of the exosome, we found the better skin quality and shortening of the downtime. So in your practice, you may use the more often of the exosome or exobalm, you will get the better result for this decrease the downtime and improve the skin quality. So this is the result that I showed to you, that you can see the more often of the exosome application, you get the better decreasing of the downtime and better skin quality compared with the control significantly. And also, if you don't have, if you have the exobalm or exosome moisturizer in your practice, it's very good product. You can see that I also do the picosecond laser high fluence also, and apply exosome 1 time, 2 times, 3 times every 2 hours. We found that you can see that the more application of the exobalm, you can see the better skin quality and also significantly decrease the downtime. So in my practice, I always, in the first 3 days after the laser treatment for acne scar, I always ask the patient to apply it 3 to 4 times daily, and then twice daily after that. Okay, and this I would like to show some of the case. This is the case with the fractional picosecond laser. Without exobalm or exosome, the patient downtime will be 5 to 6 days, and this is the with exosome, the patient downtime will be only 3 days only. This is day 1, day 3 without exosome, day 1, day 3 with exosome. You can see the efficacy in shortening of the downtime very significantly. And I would like to see that the treatment of the acne scar with exosome, you can get the better result or not. So I done the split site study. We can find that the site treated in combination of pico with exosome, we can get the better result up until the 3 months after the treatment. I'm on the process of the study of the combined pico with the exosome split phase. Maybe I can share with you in the next session. Okay, and not only that, we found that the more session of the treatment with pico and exosome, we found that the patient got better, faster recovery time, and also get the better skin condition also. And you can find comparable result with the topical exosome and polynucleotide intradermal injection. This is for the previously is about the pico. This is all after the fractional RF microneedle, or even with the thermomechanical device, you can shorten the downtime very significantly with this one. And the more session of the patient treat with exosome, you can see the better skin quality and also faster recovery period. You can see. This is day 1 and day 3. You can see the third session, patient can go back to work very normally. So this is the exosome shorter downtime after the acne scar treatment, and also improve the acne scar treatment result and improve the patient's skin quality. So I think this is maybe the treatment of choice for you. And also, when I got the Exobalm, so I tried to see that this is really work. So I apply it after split face. You can see the significant improvement from 2 or 3 hours difference from the Exobalm application. And as I mentioned to you that I usually advise my patient to apply it more often in the first 3 days, because the more frequently we apply, the better result in the wound healing and also skin quality improvement. And even for the mask, the ASE mask, I apply the patient after the laser. You can see significant difference in the redness from the 30 minutes to 60 minutes. So this is a treatment of choice for you for the post-laser or any invasive procedure. And in my treatment, I always combine the treatment of acne scar with multimodality. High fluent pico, cannula subcision, exobalm and exosome, and we got very good result even for the first treatment in almost type of acne scar. I think I don't have time for that, so I will skip a little bit fast with this. And this is my protocol in my practice. When I perform any procedure, I use the cold compression for 5 to 10 minutes, low-level laser therapy, and I will use the exosome, topical exosome, in combination with the electroporation, because electroporation make the exosome go deep into your skin more. So we want that. So, and then I apply the exosome mask for maybe 10 minutes, and ask the patient to use the exosome moisturizer 4 times daily for the first 3 days and twice daily for the rest. And if the patient, the pre-treatment, I will ask the patient to apply the sunscreen, use retinol and good acne control. And if the patient are affordable, I will ask them to use Exobalm moisturizer for 2 or 3 weeks prior to treatment. They can enhance the efficacy of acne scar treatment. Not only for the acne scar, but you can use the exosome in many of the other scar conditions. For the example, hypertrophic scar and keloid. This is, I prevent the scar from the traumatic scar. The patient heal almost completely. You can combine with the injection or other laser. This is the result. And for the atrophic scar, like pox scar on this area, you can get the better result. For the scar revision surgery, alloplastic scar surgery, striae, you can get better result. For the melasma, as the previous doctor also mentioned, I also found that the very good result of the exosome in combination with even picosecond laser. But what I love more is about the fractional RF microneedle. We can get the very good result. You can see decrease the pigmentation, also decrease the redness also. In the other case, I combine the fractional RF microneedle in combination with the exosome. You can get the better result with the melasma. I will skip for the study. You can ask the company for the detail of the study. And what is really interests me a lot is about exosome and hair loss. Exosome, as I mentioned in the Journal of American Academy of Dermatology, the very big journal, they can say that exosome may play a role in AGA treatment. We can combine in the practice. You can combine with any fractional device in your practice. If you have microneedle, fractional laser CO2 erbium glass thulium, or fractional IF microneedle. And I have published the fractional picosecond laser technique in the treatment in combination with the exosome in the treatment of AGA. And as you know that low stem cell derived exosome has a lot of components, and what is very important is microRNA, right? as you see that microRNA have the microRNA 1 to 2 have the promote effect of the hair regrowth. And this is study you can check from the Dr. Park. It's very interesting study. You can got a lot of detail, but I don't think we have time for that. They can promote the Wnt beta-catenin signaling pathway, that the major pathway for hair regrowth, and they have the hair sharp elongation. And you can see that in combination with micro needle, you can promote the hair regrowth like this. There are some of the study also. And we have published a very simple non-invasive technique that we use the exosome in combination with the electroporation. You can see the significant hair regrowth without other invasive laser or RF microneedling or even microneedle. You can see that exosome in combination with non-invasive electroporation could promote the hair regrowth, right? And this is my technique. Apply the exosome first and then use the electroporation. You can see the hair regrowth. This is already published already. So, and I would like to share with you the using the technique of fractional picosecond laser in combination with the exosome. This is my technique. I use the picosecond laser, a very low frequency to stimulate the hair regrowth. And then this is already published already. You can check in the PubMed. And then you apply the exosome. Okay. This is the result. You can see that on the vertex, you can get the very good result, not so difficult. But on the frontal area, it's quite impressive. You can see get the better result on this. Another case. So, and last but not least, but I would like to share with you about the exosome and hair repigmentation. Is it really work? During the treatment of AGA, the patient usually have the gray hair, and then we also observe that hair repigmentation after the treatment with the exosome in combination with microneedling or fractional picosecond laser. Not only me, but also another hair expert around the world. We can find that the patient got the hair repigmentation after the treatment with the fractional laser or fractional microneedle in combination with the exosome. And you can see from some results. And we just published one case. He come to me actually because he have the androgenic alopecia and he have the condition with the polycystic circumscripta. That is more than 10 years. That is mean of the loss or non-function of melanin or melanocyte. And then we perform this technique using the fractional picosecond laser in combination with exosome. You can see he got the hair repigmentation after the 4 treatment, and then he go abroad. He come back after 10 months. You can see he got some of the white area, but less than the previous treatment, right? This could be because of the cycle of the hair, not only hair stem cell, but also because of the hair melanocyte stem cell also. And then we perform another session of the treatment. You can see he also got the repigmentation result of this case. So we would like this phenomenon confirm the efficacy of exosome in the hair repigmentation effect. You can see this is the before, and he got more area of the hair, black hair in the polycystic white area. You can see this is the proximal blackening of the distal white. So it means that we have the function of melanocyte or melanin stimulation effect from the exosome. And we got the new regrowing black hair in the area of white hair also. This is also, you can see the proximal blackening of the distal white hair. What is the mechanism? Because previously the repigmentation of hair usually observed in the vitiligo or some of the alopecia areata. This is inflammatory hair disease, right? But in this condition, we don't have that kind of condition. So we found that after we extensively review, we found that the component, maybe the postulate that the component in the exosome, that is microRNA, have the function in the melanogenesis, right? Most of them have the inhibit melanin synthesis, melanogenesis inhibition, but some of them have the function of upregulation of melanogenesis, especially microRNA 200C that we could find in raw stem cell derived exosome. So this is made the postulated mechanism of the hair repigmentation in this case. Okay, and not only for that, but we also can be applied in other hair condition. Alopecia totalis. You can see this is my technique also. I love use Pico, it's fast, and apply the exosome with electroporation. Female androgenic alopecia, you can get the result. Female AGA, as mentioned, telogen effluvium, and also not only that, for the scalp dermatosis, this is the psoriatic alopecia. I use the exosome in combination with the electroporation only. And also, this is the AGA with the patient with scalp seborrheic dermatitis. You can see the improvement also. So this is my protocol. I always use the laser or fractional base device. After that, I will cold compression, low level laser therapy, and apply the exosome maybe diluted in 2 or 3 ml and use with combination with electroporation. Occlusion with shower cap, and if you have some of the exobalm or exosome left, you can let the patient use that. And we also published the paper with the very common condition of the seborrheic dermatitis, severe consistent, do not respond to steroid or terrestrial treatment. We use with the combination with the low stem cell derived exosome. I can say that exosome can improve, have a lot of application in multimodality treatment, both aesthetic and clinical dermatologies. You can combine in your practice with most energy-based device and your aesthetic procedure. They help decrease downtime and improve aesthetic outcome. And for the hair, you can get the hair regrowth and maybe hair repigmentation. However, we are at the beginning phase of exosome era, so we still need more study. Thank you so much.